experience jaw pain, clicking, or difficulty chewing, you may have a temporomandibular joint dysfunction. This condition affects the jaw joint and the muscles, causing pain and limited movement. The good news is physical therapy can help. Today, I'll explain what causes TMJ dysfunctions, how to treat it, and the simple exercises to relieve your pain. What is TMJ dysfunction? The temporomandibular joint connects your jaw to the skull and helps you chew, talk, and yawn. When this joint is misaligned, overused, or stressed, it causes us pain, clicking sounds, and difficulty opening the mouth. Common causes of TMJ dysfunction: teeth grinding and jaw clenching, poor posture, especially forward head posture, joint misalignment or dental issues, stress and muscle tension, injury or trauma to the joint. Symptoms of TMJ dysfunction: pain, tenderness, clicking or popping sounds when opening and closing the mouth, limited jaw movement or locking, headaches, ear pain, or facial discomfort. How does physical therapy help? Physical therapy for TMJ dysfunction focuses on reducing pain, improving joint mobility, and correcting muscle imbalances. A combination of manual therapy, posture correction exercises, strengthening exercises can make a big difference. Physical therapy treatment includes mobility exercises, mobilizations to realign TMJ joint, soft tissue release, simple massage and dry needling to relieve tight jaw muscles, postural training, correcting forward head posture to reduce strain, some jaw exercises, strengthening and stretching exercises to improve mobility and strength, and stress management techniques, relaxation exercises to reduce clenching. Effective exercises for TMJ dysfunction. Now, let's go over some simple exercises that can help relieve TMJ pain and restore jaw mobility. Exercise number 1, jaw relaxation, reducing muscle tension. Place your tongue on the roof of your mouth, just behind your teeth. Relax your jaw and let naturally open slightly. Hold 10 seconds, then repeat 5 times. It helps reduce unnecessary jaw tension. Exercise number 2, controlled jaw opening. It helps improve mobility. Place your tongue on the roof of your mouth. Slowly open your mouth while keeping your tongue in place. Stop if you feel pain, then close slowly. Repeat this 10 times. Encourages poor jaw movement and reduces clicking. Exercise number 3, chin tucks. It helps correct posture, reduce strain around the neck and jaw muscles. Sit up straight with the shoulders relaxed. Gently tuck your chin in, creating a double chin. Hold for 5 seconds, then release. Repeat it 10 times. It improves head and neck posture, reducing strain on the TMJ. Exercise number 4, side-to-side jaw movements. It improves flexibility and strength of the muscles. Place an object, such as a pencil, between your teeth. Move your jaw slowly side to side. Hold each side for 5 seconds and repeat 10 times. It strengthens the jaw muscles, improve mobility of the TMJ joint. Let's answer some common concerns about TMJ dysfunction.
Will my TMJ pain go away on its own?
In some cases, yes. But if pain lasts more than 6 weeks or few weeks, physiotherapy can help speed up recovery and prevent worsening symptoms.
Should I avoid certain foods if I have TMJ pain?
Yes. Avoid hard, chewy, sticky foods. Stick to soft foods that don't put too much strain on your jaw.
Can stress really cause TMJ pain?
Absolutely. Stress leads to jaw clenching and muscle tension, which worsens TMJ symptoms. Relaxation techniques can be very helpful. TMJ dysfunction can be frustrating, but with the right exercises and treatment plan, you can relieve pain, restore proper jaw function. If you are struggling with the jaw pain, headaches, or clicking sounds, visit a physical therapist for a personalized plan.